And it's so interesting that we have the same name and it's spelled the same. Hello, everyone. Thank you very much for giving me this opportunity to talk with you all about dental health from a literal and a spiritual perspective. I am a dental hygienist and I'm also a registered nurse. This is just simply stated because I want you to understand my love for understanding how the human body operates, in addition to how much I enjoy sharing what I understand about the human body based on the professions that I have. So I started out as a dental hygienist in the United States Air Force, and then I started as a dental assistant, and then I went on to becoming a dental hygienist. While in the Air Force, I was trained in dental forensics and administering local dental anesthesia when I actually take care of the patients when I have advanced cases. So I was able to work pretty much independently on my own. I was able to manage two preventive dentistry departments on Aviano Air Base in Italy, and also on Anderson Air Force Base in Guam. I then went on to serve as an interim dental manager in both of those clinics, especially in Guam, until the manager actually came there. So I had to deal with a lot of military stuff and managing a whole entire clinic. After I was impressed and convicted to leave the United States Air Force, I went to work for the Indian Health Service in Washington, where I was the only dental hygienist that was responsible for the Native American community out there in Washington, Eastern Washington. And my focus was really on children due to the preventive nature of my role as a dental hygienist. Okay, and I also served as their dental infection control officer for the entire clinic. And this is really to emphasize the keen attention I had to pay when dealing with patients and treating them. I am sure you would like to know that somebody is very, very keen in taking care of the instruments that they use on you when they are taking care of you. So this was a big, big deal for me. So my approach during this presentation will be from a dental preventive point of view. So before I begin, I just want to put this disclaimer out there for everyone. Please understand that this presentation is for providing educational information purpose only. It is not for diagnosing or prescribing any treatments at all whatsoever. My goal during this presentation is to help people to understand the basics of dental health so that when you go to a dental appointment, you are empowered to advocate for yourselves. Okay, my goal is to empower and enable people to think and to know what types of questions they should ask when they're at a dental appointment, should they have any concerns about the treatment plans that are presented to them. So if you have any concerns, okay, if you have any concerns at all that goes beyond my scope of preventive dental education, please, I'm going to encourage you to consult with a professional dental therapist or a dentist. Okay, this position of a dental therapist is fairly recent. It is pretty much equivalent on the medical side of a nurse practitioner. Okay, just so you understand what those are. The teaching that I'm going to go through as I do this presentation will be from three perspectives, and these are the Bible, the spirit of prophecy, and good science. Okay, so as we begin, I would like to share that sickness and disease arise or they come about from one of three reasons, just so that we understand that. It could be for the glory of God, as you can see in John 11, verse 4, where the Bible says that when Jesus heard that, and I'm quoting John 11, verse 4, when Jesus heard that, he said, "This sickness is not unto death, but for the glory of God, that the Son of God may be glorified thereby." This could be the reason why one of the reasons why people may get sick. Sickness and disease can come about because there is a violation of the natural laws. Now, there are certain things that we have been told that we should not do with our mouth. Keep in mind the perspective is dental health, okay? And so in Proverbs chapter 10, verse 26, it says, as acid is very, very dangerous for the teeth. And in Proverbs chapter 10, verse 26, we read this text, as vinegar is to the teeth and smoke to the eyes, so the sluggard to them that sent him. We're looking at the teeth here. We're told that whenever you get up in the morning, if you've heard this before, you should drink some warm lemon water. Okay, that should enable you or promote your body to go to the bathroom. But you do not want to drink that without a straw, really, because you will damage the enamel of the teeth. We're going to get more into that in a little bit. Yes, vinegar is extremely, or any kind of acidic type of substance, it's very, very acidic to the teeth, and it's bad for the teeth, okay, and other parts of the body as well. And especially if you're drinking apple cider vinegar, I'm going to encourage you not to do that. Okay, so this is why we're advised not to use it inside our bodies. There's other things to vinegar that is bad. Okay, however, lemon water is good, but you still want to drink that with a straw because it is very acidic. Okay, not taking care of our mouth can and will eventually lead to some type of oral or systemic disease. And this is one of the main reasons why I'm doing this presentation today. Thank you very much, Table of Christ, for inviting me to do this. Thirdly, sickness and disease can be a result of a violation of spiritual laws. The two best examples of this is in the Bible, and it can be found in Numbers chapter 12, verses 1 to 10. This is when Miriam became a leper because of her blatant disregard to the order of leadership God has established as having Moses being the one to lead the children of Israel. Okay, the other one is in the fifth commandment, where we are told, honor your father and your mother, that your days may be long upon the land which the Lord thy God giveth thee. If children disobey their parents, this is not good for them. They may very well get sick, and we may not know that. Now, this is not to put or create a picture in your mind that God is arbitrary. This is just simply understanding that when we violate a law, there is consequence. And so to avoid all of that, let's just learn what is right. Some people violate laws because of ignorance, but they still end up getting sick. And so it is good to just learn what is right. And this is why, as a fellow medical missionary, our number one objective is to educate. Okay, in addition to other things, but one of the main things is to educate. Okay, let me continue on here. So let's just take a look at Proverbs 26, verse 2. And this is the first part where it says, the curse causeless shall not come. Now, disease never comes without a cause. Okay, and so when we think of disease, we should understand that it comes about because of something else. This means that there is a reason why something happens. So if you're not diligent with keeping your mouth clean, then you can expect that something unfavorable will happen. Therefore, it is vitally important to know and understand that disease never comes without a cause. Okay, so but before we go into the definition of what disease is, I would like to pause and really emphasize something very important about dealing with disease and being a medical missionary. This is a work that we should take a hold of now in some way or the other. So if you know something, if you have a job that can help you to share the message of God's love to us, then this is something that we should do. Okay? Now, if while you are doing the work of God and we do not address, one thing we want to do is make sure that we address the mind when we're doing these things. If we don't address the mind, okay, and help people understand what faith in God is, then whatever we are doing for the one that is sick will not be as successful as we diligently work towards healing or helping that person to be healed. We want them to see Jesus and to understand that what faith truly is. It is faith that will enable that person to know and believe that it is God who does the healing and not what the items that they're using that is working towards them healing. But we also want to emphasize to them that healing is for the purpose of enabling that person to be restored in the image of God, to be a dedicated servant of God, and to bring soul into a saving relationship with their Savior. Okay, so this is why we're addressing disease and why we're looking at dental health. So what is disease? Okay, well, disease is an effort of nature to free the system of conditions that are a result of a violation of the laws of health, meaning how the body functions to free itself of condition or diseases that are a result of violating the laws of health. So what are the laws of health? I'm quite sure a lot of us on this line is familiar with the laws of health. And these are pure air, sunshine, abstemiousness or temperance, rest, exercise, proper nutrition, the use of water, trust in divine power, cleanliness, and purity of mind. This is taken from the Ministry of Healing, page 127. So when any of them are violated, the person will have some sort of disease, even if they do not feel it immediately. But the thing is that we do not want to have any diseases. We want to maintain health. After all, what is our first duty? Our first duty toward God and our fellow beings is that of self-development. Every faculty with which the Creator has endowed us should be cultivated to the highest degree of perfection, that we may be able to do the greatest amount of good of which we are capable. Hence, that time is spent to good account, which is used in the establishment and preservation of physical and mental health. This presentation is simply to promote and motivate every single one of us to preserve our physical and our mental health from a dental health point of view. So before I get into this whole presentation, allow me to share a very vital quote with you at this time. This is from the book Temperance, and it says, Satan gathered the fallen angels together to devise some way of doing the most possible evil to the human family. One proposition after another was made, till finally Satan himself thought of a plan. He would take the fruit of the vine, also wheat, and other things given by God as food, and would convert them into poisons, which would ruin man's physical, mental, and moral powers, and so overcome the senses that Satan should have full control. Now, I have included this slide mainly because of what I have been studying and learning recently about the many things that negatively affect our overall health, not just dental, but in this case, dental. This quote sums it all up so very well that I would be remiss if I did not include this so early in the presentation. Please understand that this quote is not just referring to quote unquote food alone, but food that is a concern. I'm inclined to food is a concern. I'm inclined, therefore, to believe that it includes anything that we put inside our mouths, even if we may think it is food, or anything that we may use inside of our mouths so that we can properly consume the food that are made available to us. Please note that I'm being very specific with my choice of words. Keep in mind that the objective of Satan is to have full control. Now, because of time, I will not be able to present a lot of what I initially have presented in the past on dental health, not to mention what I've been studying since the last time I actually presented on dental health. But I pray that you would do your research to learn the truth, the reality of this particular quote that God has so graciously passed on to us through Ellen G. White, who is the author of the book Temperance. With that said, let's dive in and see how much we can learn about this interesting topic. But before I do that, I must say that from the Bible, there are two things that I've learned from reading the Bible that has gotten and will get people into a lot of trouble, and that's the mouth, and more specifically, the tongue. In Genesis chapter 3, I know this is not on the screen, but in Genesis chapter 3, verse 17, God said, "But of the tree of the knowledge of good and evil, thou shalt not eat of it, for in the day that thou eatest thereof, thou shalt surely die." That has to do with our mouths. In James chapter 3, verse 5, it says, "Even so the tongue is a little member, and boasteth great things. Behold, how great a matter a little fire kindleth." In Counsels and Diets and Food, we are told that the controlling power of appetite will prove the ruin of thousands when, if they had conquered on this point, they would have had moral power to gain the victory over every other temptation of Satan. Remember, Satan himself came up with the plan so that he can have what? Full control over the senses. Now here, for the mouth itself is where things get into our bodies, okay? For the tongue, this is where many things exit the body and do a lot of damage to self and to a lot more others than we can even imagine. That is even hard to reverse. So we need to be careful. These are just some of the many diseases that oral health or dental health have a direct connection with. Okay, you have halitosis, dentophobia, heart disease, arteriosclerosis, erectile dysfunction, diabetes, respiratory illnesses, preterm labor or preterm birth, colon cancer, obesity, Alzheimer's disease, liver disease, kidney disease, and so many more. But I will not be able to talk about all of these today because of the time. Okay, but I will address at least two of them, one dental and one systemic disease, so that you can have an idea as to what the enemy of soul is actually doing to the body that was created in the image of God. Okay, but let me share some brief information to you about oral health. Okay, did you know that your mouth has anywhere from 300 to 500 different types of bacteria living in it? This is called the oral flora, and they actually belong there. And these, from my recent study, plays a major role, guess what, with nitric oxide. For those of you who have been in the classes with Pastor Koku, they play a major role with nitric oxide, but I can't go into that at this time. And when some of these oral bacteria or microflora or bacteria, when they get out of control, for whatever reason, this is what causes oral diseases to happen. Did you know that not taking care of your teeth or oral health can wreak havoc on your entire body? It is my goal that by the end of today's presentation, the short amount that I'm going to share with you, you will have a clearer understanding of how true this statement really is. Did you know that you can prevent a lot of illnesses with proper oral hygiene and regular dental visits if you can afford it? But the main thing is proper oral hygiene. And this is not just oral disease or oral illnesses, but it's actually systemic diseases as well. Today, globally, an estimated 2 billion people suffer from caries, which is another word for cavities of their permanent teeth, and 514 million children suffer from cavities or caries of their primary teeth. This is according to the global burden of disease. Yet, dental caries or tooth decay is the most prevalent disease known. Okay, these are some oral diseases. These include dental cavities or tooth decay, which is the most preventive type of disease known. You have periodontal disease. You have tooth loss or edentulosum. These are people who do not have any teeth. But even if you don't have any teeth, it is vital that you still take care of your mouth, even if you don't have any teeth, because a lot of things happen inside the mouth. You have oral cancers. You also have oral facial clefts. This is a deformity of the face from something that happened while the baby is in utero. You also have oral dental trauma. You have cleft lip and cleft palate, which opens up the communication between the nasal cavity and the oral cavity. That can be pretty dangerous. And you also have NOMA. Give me 1 second, everybody. Okay, you also have NOMA, and I put a star there because this is something as I'm studying, I'm constantly studying dental hygiene because I still have both of my license. My nursing license and my dental license are active, and I have to keep them up to date. So I'm constantly reading and studying something, even though I am a stay-at-home mom that homeschool my son. Well, NOMA, I learned recently, is a severe gangrenous disease starting in the mouth that primarily affects malnourished children. I spared you from showing you pictures of this because some of these pictures are absolutely hideous. You can look it up on your own if you want to, but I'm not going to put that image in your mind. It is a polymicrobial, which means many different types of microbe infection that can lead to fatal sepsis. Now, for those of you who are not familiar with what the word sepsis is, this is when the infection gets into the bloodstream to the point where your body is not producing enough white blood cells, okay, to fight off the infection. Okay, and so it is interesting to me that this stuff is mainly seen in young children between like the ages of 5 and 6. Okay, it's absolutely horrific. And this is why if you have your children, I would encourage you to have them with you as you're listening to this presentation. This is not just for adults. Okay, because in Helpful Living, page 13, we read a practical knowledge of the science of the human life is necessary in order to glorify God in our bodies. It is therefore of the highest importance that among the studies selected for childhood, physiology should occupy first place. If we are not teaching our children how to become familiar with their bodies, as they grow old, somebody else will teach them for you. And this is not what we want. Okay? So we want to teach them from babyhood what are the parts of their body? What is it used for? And as they get older and they can understand and they mature, we need to increase that level of education for them. Okay? So let me just give you a brief background of a child's mouth. This text that I really, really love from Psalms 139, verse 14, it says, I will fear thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. Around the 6th week, okay, the 6th to the 8th week in utero, some women do not even know that they are pregnant during this time. However, a lot of things are taking place. Around the 6th to 8th week in utero, the teeth of a child starts to develop. By the time they are born, the teeth are close to being ready to erupt through the gums. This is why around 6 months, we see the two lower teeth coming into their mouth. Okay, I'm not going to get too much into the science of it, but just know that it actually starts forming around 6 weeks in utero. So you want to be very careful during that first trimester. At 12 weeks in utero, our adult teeth starts forming. Okay, so you can see in here the blue picture, the blue teeth in this 2 to 5 year old skull of a child. You can see the adult teeth. It says buds of permanent teeth. The deciduous teeth are called your baby teeth, and then you have the buds of your permanent teeth. So at 12 weeks, our adult teeth are forming. So anything that the mother does during this time can be seen our mouths way after we are born. At this time, the tongue coming up into the mouth will then fall so that the palate can close. If something is happening to the mom where she is traumatized or something happens to her and that palate doesn't close, this is what happens when you have a cleft palate. Later on, if something happens to her, you would see the cleft lip. So when I look at someone and I see that they have a cleft palate or a cleft lip, I know that something happened to that mom during her 12th week in pregnancy. This is how amazing our bodies are. So when you see, and so at this, with this, I don't have the picture here, but give me a second. So we want to ensure then for children, I hope you can see the picture here. For children, then, we want to make sure that we're taking care of the mom. And today's Mother's Day, happy Mother's Day to all of the mothers that are on the line. You could be doing something way better right now, but I thank you for being here with me. Children then should be introduced to dental care or with a dentist from the first tooth that comes into their mouth. Why? If you can. Now, I'm saying this because a lot of people may not have the insurance or the money to take a child to the dentist, and that is understandable. Okay? So remember what the quote is from Healthful Living, page 13. Physiology should occupy first place. We as moms, as parents, want to understand when that tooth comes into that child's head, you want to make sure that that child is aware of it. You want to be aware of it. They're not going to consciously know, but you just praise them that their teeth are coming in. And when their teeth are coming in, it's very painful. And this is why you have these teething rings or a cool rag or something, because it is painful for them. Okay, but the reason why you want to introduce them to a dentist when the first tooth comes in is because it's to help to dispel dental phobia. All right, most children, most adults, let me say this the right way, most adults tend to become afraid of the dentist, but this starts in childhood because something happened to them when they were a child. Either they had a cavity or something and it's painful for them, and then it's aggressive to remove a tooth that is broken off because it's rotted off. And so you want to introduce them as early as possible to oral health, whether it's to a dentist or to a grandmother or somebody needs to help them to understand these things, even as a child. Babies should have their gums cleaned with a moist rag after each feeding, whether it's the breast or the bottle. Okay, and the reason that you don't want things to build up on the teeth, once the tooth comes into that head, the oral flora actually changes a little bit and becomes more specific as to what it's going to be for the rest of that person's lives. These oral flora bacteria, you need to keep them in check by keeping the mouth clean. Never allow a child to fall asleep with a bottle, especially with juice, milk, or any liquids with sugar. Because what you're actually doing when we do that is actually setting up that child for a lot of pain because cavities are going to start to develop because of that sugar. Okay, and I mean, think about it. It's a baby. If you leave a child with a bottle in their mouth, they may very well choke. And I don't want to sound as if this is a light thing. It is not a light thing. I mean, but we want to think about what we're doing. Okay, it may be soothing to the child, but it is not safe. And this is what we call baby bottle decay or baby bottle tooth decay. Always be involved with your child's dental care and talk with them about it as you teach them. Okay, even if you have to get in and floss their teeth for them, okay, because bacteria has no respect of persons. Okay, and one of the subjects I especially loved when I was going to school was microbiology. And I respect these little organisms because they can be very dangerous when they get out of control. So always be involved with your child's dental care. And then remember that dental caries or cavities are the most prevalent disease in children. Yet it is entirely preventable if we just take simple steps to keeping their teeth clean. Now, this picture that you see on the bottom, well, it looks like it has like almost 3 different colors. This is an adult mouth. This is someone who, when the mother during that 12th week, for whatever reason, she was taking a drug called tetracycline. And what this does, it actually stain or alter the color of the permanent teeth. This was in the 12th week because the adult teeth starts developing during that time. And when this individual starts getting their permanent teeth, like at 7 or 8, that's when the front teeth starts coming in. And you would see this discoloration, and you know that something happened to the mother during that time where she had to take this particular drug. So let us just take a look now at some general anatomy of the mouth. Okay, here you have the gums. Okay, the anatomy of the oral cavity. You have your upper lip, your teeth. What I really want you to pay attention to is what we call the gingiva or the gums. You have 2 different categories, 2 different names for your gums. On the left, if you're looking at the screen, on your left side on the top picture, you would have the attached gingiva. That's the one closest to your teeth. And then you have the alveolar mucosa. That's the unattached. Okay, this is the one that actually covers the bone that your teeth is in. And then you have your marginal gingiva. All of these are very important to a dental person. Every single one of them. Now, for those of you who have not heard this particular presentation, please do not answer this. But for the bottom picture, if you can tell me, do you think that this person on the bottom with the black gums, do they have a disease, or you think that's perfectly okay? Just say okay, or there's something wrong.
Something is wrong.
Okay, somebody say disease, somebody say something is wrong. I want to reassure you that there is absolutely nothing wrong with this individual's mouth. As a matter of fact, this person has very good oral hygiene just looking at their picture, and their gums are perfectly healthy. These are called pigmentation, just like how you have different complexions of people, from fair to completely dark. You know, this is what happens with the gums. And this is usually for people who are dark skinned or not as fair. Okay, but that is a picture of what the attached gingiva looks like, because you can see the alveolar mucosa above it. That is pink. Okay, so that's just pigmentation from the melanin in this person's body. Okay, so just be aware that there's nothing wrong with this person's mouth. You also have the tongue. I'm not going to really talk so much about the tongue, but the tongue is very, very important. Okay, because your tongue is what actually signals to your stomach what type of food is coming down. So it communicates with your stomach. It's very, very important. Besides talking and pronouncing your words properly, your tongue actually has a communication with your stomach. Let's move on. Here you have more now zeroed in on the tooth itself. This is the dental tooth anatomy. And from a cross section. So it's like as if we take a tooth and we just cut it in half in addition to the bone. Okay, here you have the enamel, okay, which is the crown of the tooth. Okay, you have the enamel, and also you have the dentin. Now, I would like for you to pay very close attention to this. If if I do not do this, everything else that I talk about later on in this presentation will make no sense to you. So I'm just taking my time to help you to understand the anatomy, and then we're just gonna move forward. But you have the enamel, which is a little bit wider, and then you have the dentin. Now, if you pay attention to this, you should see that the dentin is a little bit more yellowish in color compared to the enamel, okay? One is more yellow and the other is closer to white, but no one has, I have to say that no one has quote unquote white teeth. So when you see someone with white teeth, it is not natural. It is not natural, or you're looking at their teeth in contrast to their actual complexion. So when you look at the picture of a dark skin, like a very, very dark skinned individual, naturally their teeth are going to look much whiter than someone else's who is very fair skinned. Okay, so that is why people may think that someone's teeth is more white than somebody else. You have to look at the complexion. And even if you were like a black turtleneck and you're light skinned, your teeth may look a little bit whiter because your eyes is actually contrasting the two different colors at the same time. So it is more likely if their teeth are like really white, it's perhaps from a result of laser treatment or bleaching the teeth, or they may be wearing veneers. These are caps that are placed on the front surfaces of teeth to give them that white appearance. Sometimes this can be for aesthetic purposes because of some type of developmental issue with the enamel itself, where they could be having pitting on the enamel itself, where their teeth look like there's a whole bunch of holes in it. So they'll put these veneers and they would naturally make it a little bit whiter for the person. Okay, and pitting can come from fluoride use. Okay, so you have the enamel, you have the dentin. Another thing I want you to pay very close attention to are these lines within the dentin. These are very, very important. Okay, so pay very close attention to the lines within the dentin. Okay, you also have the gingiva or the gums. Okay, you can see it pointing there. And then you have the pulp. All right, this is the pulp chamber. This is the vital or the live part of the tooth, where the blood vessels, which are the arteries and the veins and the nerves, are located. Okay, this is pretty much what causes you to feel hot and cold on your teeth when you drink something hot or cold. So when a root canal is done on someone, these are the parts. This is the part that is removed. They actually go in and extract the nerves and the arteries and the veins from the pulp chamber and then down into the actual root canal. They actually go all the way to the bottom where the nerves comes in and innervates the tooth from the tips of those roots. So when you have a root canal, they take out the pulp chamber, they clean it out, and they clean out the actual canals themselves. Please pay close attention to these lines in the dentin. Then you have the cementum. Okay, the cementum is very, very important. Its function is like what it says, like cementum. It's to cement something to something else. Underneath the cementum, you have what's called the periodontal ligaments. These are ligaments that anchors themselves into the cementum and anchors themselves to the alveolar bone. If you can see, it's the last one on the left. The alveolar bone is that spongy or holy looking type structure on the screen, and that's the bone. The cementum is what anchors the periodontal ligament to the tooth and then anchors it to the bone. So the cementum is very, very important. When we are treating patients and we're working within that space of the cementum, we have to be very careful not to remove a whole lot of it. Okay, and then the alveolar bone is actually the bone that actually shapes your face. If you look at someone who loses their teeth, okay, their face will actually sink in. That's because they lost their tooth and the alveolar bone is gone with it. It would never come back. If there's no teeth, then there's no alveolar bone and the shape of the face is altered, okay? Now there is one area that I have not labeled on the screen because this is not a good picture for me to show that, and that is called the sulcus. And I will show you that in a little while, but first let me just take a quick look at the difference in the color naturally of the enamel versus the dentin. Okay, here you have the enamel seen in contrast, with the dentin. You can see that the dentin is yellowish in color. Now, I say this because oftentimes people tend towards using abrasive toothpaste, such as whitening toothpaste or baking soda, or even in one case I've learned from a very dear person, they use Ajax to brush their teeth so they can have white teeth. It's not gonna happen. I'm sorry to burst anybody's bubbles that you're out there trying to get white teeth with all these abrasive agents that you're putting in your mouth. It's not gonna work. So over time, what will happen, these abrasive tooth aids will actually damage and brush away, like sandblasting, the enamel to the point where the enamel gets so thin, your teeth becomes more sensitive. And guess what? Your teeth starts looking a little bit more yellow because you're brushing away the enamel, exposing the yellow dentin underneath. Okay, so it defeats the purpose of trying to get white teeth. Now, there are other ways that the enamel can be eroded, like drinking acidic things like lemon water or sucking on lemon or anything like that. But we'll touch on that some other time. Okay. Now, the sulcus. Okay, just keep in mind that the enamel and the dentin, please pay attention to those lines. I'm saying that, that's like the third time I'm saying it. Please just pay attention to those lines in the dentin, okay? Now, here is the sulcus. This periodontal probe is an instrument that we use in the dental clinic. This is a picture of the sulcus, otherwise known as the pocket. This is where the gum tissue comes all the way up to the neck of the tooth, okay? This is where the crown ends, so the enamel ends, and the root begins. That's the neck of the tooth. The pocket space here should be no more than 3 millimeters in depth. And you can see it on the periodontal probe, the instrument that we use to measure these pocket space between the gums and the teeth. This area of the tooth anatomy is very, very important to understand. Okay? Because this is where oral diseases, certain types of oral disease tend to begin, primarily known as periodontal disease, okay, which is directly connected with systemic disease. So please keep this picture in mind. You do not want a dental hygienist or a dentist probing any more than 3 millimeters. Okay, you can see it on there, the measurements, 1 to 3, 3 to 5 millimeters, 5 to 7 is moderate periodontal disease, and 7 to 10 is advanced periodontitis. I have treated patients with 14 in depth, and this is just desperately working to encourage the body to reattach itself from cleaning off that root. Okay, so please keep that in mind. Again, there's that little picture there. Now, I want to zero in more so on these lines that's within the dentin. If this is too much for you, just stay with me. I'm almost done with this. It's actually the last picture of the anatomy that I'm going to go through. You have the pulp cavity or the pulp chamber where your nerves are. You have the enamel, which is the whiter area, the dentin, which is the yellowish area. Okay. Now, within the dentin is where my attention is right at this point. Okay, let's just take a closer look at how the tooth communicates with the oral environment. So when you drink hot tea or ice cold water, and you feel that really, really sharp sensation, okay, that means that these little lines in the dentin, if you look on the picture to the left, you have these blue lines that comes out to a circle. You have the gums that's receding, so now parts of the root is exposed. These little holes are called dental tubules. This is where you have the odontoblasts. These are cells. These are building dental cells for the tooth. And what happens, they are wrapped around with nerves, and these nerves extend into these tubules. So whenever you're drinking something hot or cold, you are going to feel that sensation because it's going to travel through those tubules right to those nerves. And you're going to feel that immediately, especially if you have receding gums. So when you even put your fingernail on a receded gum line on a tooth, you will feel that sensation quickly because you're moving that fluid, and that fluid is going to agitate the nerves, and you're going to feel that. Okay, keep in mind when you do a root canal, it is very difficult to clean these tubules. This is why people end up having problems with root canals. I'm not going to go into that because you cannot clean these tubules successfully in a root canal. All right, so let me move on. Okay, so dental diseases. If not at all, a lot of diseases that affects the body often starts in and with the mouth. Recall that there are anywhere from 300 to 500 different types of microorganisms that lives in the mouth, known as your oral flora. So let's explore a little bit how these can contribute to the health or disease systemically of a person's body. All right. Now, in a healthy mouth, the oral flora is in a balanced state. Okay, food is eaten, oral hygiene is done on a regular basis. They have visits to dental professionals or are done on a regular basis, and their mouth is happy and the body is healthy. Okay. But what if that's not the case? Then disease is going to set in. But we need to understand what happens when this disease when this disease starts in. We need to make sure that we know how to deal with it, how to approach it. And first, we need to find out what is the cause. What is the cause of the dis-ease? Remember, what disease is an effort of nature to free the system of conditions that is a result of a violation of the laws of health. So we need to find out which law did we violate. So we need to find out the cause. The next thing we need to do is to change unhealthful conditions. If the mouth is dirty, go ahead and clean it. Go ahead, if there's cavities in the mouth, go ahead and get it out of there. Third, we need to correct wrong habits. If we have a bad habit of not brushing and brushing our teeth and keeping our mouths clean, then we need to change that. I've had people who tell me that I don't like brushing my teeth. Some people don't brush their teeth because they're afraid of brushing their teeth. I've had patients like that. And if time permits, there's even a case that I had in here of someone who didn't brush their teeth for 20 years because they're afraid. Okay, so keep in mind, again, as gospel medical missionaries, we're dealing with the mind. Okay, we're dealing with the mind. And then fourth, then we assist nature or the body to get rid of impurities and reestablish health. That's Ministry of Healing, page 127. Now, so what is the cause? For a lot of oral diseases, dental plaque and biofilm is the cause. Now, what is dental plaque and biofilm? These are your main culprits for these dental diseases that will lead into systemic disease and or their proliferation, making them worse. We need to understand what dental plaque is. It's actually a sticky film of bacteria that constantly forms on the teeth. Okay, it is constantly forming on the teeth. It is made up of bacteria which produce acids after you eat or drink. Now, what is going on? Why are they producing these acids? Well, they feed off sugar. Bacteria love sugar. And whenever we eat anything with sugar, whether it's a healthy food or a not so healthy piece of chocolate bar or candy or what I call cavity on a stick, lollipop, okay, they are going to release their toxins or waste products called endotoxins or exotoxins rather, and that is what damages the teeth and causes disease. These acids can destroy tooth enamel and cause cavities and gum disease. Now, biofilm is altogether another horrific thing as a result of sin. It is a complex and well-organized community of bacteria. It is formed by bacteria sticking to each other and often adhering to a surface. Okay, and what it is that they actually form a community where they communicate with themselves. And it is absolutely amazing how this thing operates. You would have to go I would have to go a lot deep into it, but I'm not. One of the main complex or bacteria is the Streptococcus mutin okay, this is what actually helps to produce that complex matrix in the dental biofilms. Okay. So I want you to know that as soon as you're finished brushing your teeth, the dental plaque will start to form again. Just like as soon as you finish taking a bath, your body will start the process of getting dirty again from sweating or moving about or anything like that. And it actually takes about 24 hours for it to form to get to that sticky state. This is why you would want to brush your teeth after eating, ideally, or and floss your teeth at least once in a 24-hour period to keep this from forming on your teeth once you get your teeth properly clean. It takes about 2 to 3 days for the plaque to become hard, which is a term that we call tartar, more correctly, calculus. And at this point of it becoming calculus, you cannot brush or floss it off. You have to professionally get it taken off. Or you would do some things like some of the patients that I've had, they'll try to do it by themselves at home, and that is dangerous. And I'll just segue a little bit here. When you go into like a store and you see dental instruments for sale, do not buy them. It is not safe. They are not sterile, they're not sharp. And if you put something in your mouth and you start bleeding, you are going to introduce some kind of infection into your bloodstream. I would not encourage you to do that. So please be mindful, that's just for sales and money making for those who are selling those things. So let's take a look at what plaque looks like on the teeth. Okay, so this first picture that you see with the dental instrument, that is what plaque is. So if you have eaten today, don't feel bad. If you run your tongue along your teeth and you feel a bit of grittiness on your teeth, that's dental plaque and you need to brush your teeth. Forgive me if I'm being blunt, but that's really what it is. Okay. You have the term biofilm. It's not just on the teeth. It's just a name for a complex group of bacteria that is congregating together to cause problems. In this sink, the picture of the sink, you have that pink looking debris on the silver part of the sink where the arrow is pointing. That's biofilm. You have biofilm all over the place. You have biofilm in your faucet. You have biofilm in tubes. And this is why in the hospital, we have to be very careful with the tubing. And when we have central lines, you have to change that after so many days, few days, like 3 days, and to make sure that nothing is growing in that line because you don't want to hurt that patient. So everything that we do, there's a reason for it. And we're protecting people from things that they cannot see. Here you have a disclosure of the biofilm on the teeth. Some people can't see it. So what we use is some disclosing agents. And this is where we can see how this person is not effectively brushing their teeth or their teeth have not been brushed in 24 hours. So we were able to see that. This is another picture of a child's teeth. This is dental plaque. And this is another picture of the amount of plaque on this child's teeth. This child brushed mainly up towards the biting surfaces, but along the gum line, they're not brushing very well. And this child actually brushes the bottom left side of their teeth better than anywhere else in their mouth. So this child must be right-handed. You can tell all of these things just by looking at somebody's mouth. Now, how does dental cavities form? Here you have a cyclic picture of what's happening. You have a healthy tooth, a person eats something, the bacteria utilizes the sugar and it gets energy and they produce acid from their byproducts or their waste products. Okay, if it's not brushed off, the teeth are surrounded by a very acidic environment and the enamel starts to break down. It actually starts to break down the enamel and the bacteria just stays there. The saliva is actually there to help to get rid of most of these bacteria, but if we're not brushing because of the sticky nature of dental plaque, it will stay attached to the tooth. Okay, these are dental cavities in people, what it looks like. This is a child. You can actually see in that first picture on the upper left, right on those front teeth, you can actually see the pulp chamber of that child. Can you imagine how much pain this child is in just by breathing in? When I was on the Indian reservation, I actually encountered children like this. One of them was a little girl, and when I went to check her teeth, because I would go in to their schools and look at their teeth, and when she smiled for me, my heart sank. And she was like in so much pain. She's quiet because nobody listens to children. Well, some people don't. And when a child said my teeth is hurting, the parent not knowing what's going on said, just be quiet, go sit down, go play, let me give you a candy or something and make the situation worse. There was a child that I saw that looked just like this. And it took me all night long, up until 8 o'clock in the night, trying to get him into the oral surgeon so that they can go ahead and extract these teeth, because that child is not only feeling a lot of pain from breathing, that child could not eat or anything like that. And when I went back to visit, the child was perfectly fine because they were able to get these things fixed. This picture on the lower right-hand side, that's what the Streptococcus mutant looks like. And that's the main culprit in forming dental cavities. Let's move on. So this is one of the main diseases that I really want to look at. I don't know what my time is. How am I doing on time, Sister Rhonda or Camille?
You're doing good. Go ahead.
Okay, thank you. All right, so I really want to focus in on two major diseases, the oral disease and then a systemic one. Periodontal disease or gum disease is pretty much when there's something going on with the gums themselves. Okay, the teeth are perfectly fine. There's no cavities. It's really the supporting structures of the teeth. When you hear the word perio, just think something that surrounds and supports something else. Just like you will have your pericardium, that is the sac that surrounds the heart and prevents friction when it's beating. There's a fluid in between the heart and actually that pericardium so that there's no friction there. So when you hear periodontal, just think the supporting structures that surrounds and supports the actual tooth itself. Okay, gingivitis is when there's inflammation of the gums, okay, due to a prolonged presence of dental plaque on the teeth. It's now irritating the gums. Okay, and I already talked about you feeling any kind of grittiness, there's plaque on the teeth. Now, this dental plaque, if left on the teeth for days on end, the gums will eventually start to react. They will start to get red and swollen and even bleed during any attempted oral hygiene, especially during flossing. Okay, and most of the times when people are brushing their teeth and they see their gums bleeding, guess what they do? What do? Just tell me in the chat real quick. If you see your gums start bleeding, what are you going to do? Are you going to continue flossing, or are you going to stop brushing, or are you going to stop? Somebody tell me something. Okay, Camille Jane said they're going to keep brushing. Somebody said stop. Most people stop because they're like, oh my goodness, my gums are bleeding. And they think that they're the one that's doing it. But really, what it is that the gums are so inflamed because of this irritant that your body now is bleeding. You're going to see a little bit more why that is happening, more specifically why. So you don't want to stop. You actually want to brush and get that plaque off the teeth because that's what's irritating the gums. Okay. Now, what happens? This bleeding then is an indication that there are open wounds on the surface of the gums that faces the tooth. Okay, that just rests up against the teeth. Okay, this is an ideal situation for a bacterial plaque to enter the bloodstream. However, if there's effective treatment at this stage of periodontal disease, such as proper oral hygiene and or dental cleaning, or what we call prophylaxis or prophy, it is entirely reversible. The gums go back to a state of health and the bleeding will stop. But if left untreated and more plaque is allowed to build up on the teeth, that this disease of gingivitis will then develop and progress into becoming what is known as periodontitis. Okay, which is inflammation of the surrounding or supporting structures of the teeth. So what's the difference between periodontitis and gingivitis? Well, gingivitis only affects the gums. Periodontitis actually affects the actual supporting structures of the teeth, which leads to tooth loss. So let's take a look at what I'm talking about. I'm sorry, here you see the gums is swollen in that picture. Okay, you have the plaque on the teeth, and then you have the inflamed gums, and that's what gingivitis is. Now here, what you are looking at is that same periodontal probe. You can see where the crown ends, that line, and you can see where the roots are. Now these pedonal ligaments, okay, between on the roots and the alveolar bone, all right, not the healthy gum tissue, you're looking at the bone. The bone, you have bone loss on the right, and you have a healthy gum tissue and supporting structures. What happened is when this plaque and tartar or calculus starts to build up on the teeth because it's poor or no brushing, poor or no flossing, the gums become irritated. Just like if you had like a rock or sand pebbles in your shoe, the bottom of your foot is going to become irritated. And what do? You will reach down and take your shoe off. But what your body is naturally doing is extracting the tooth on its own because of that irritant. And so when you see your gums bleeding, that's not when you want to stop. You want to actually get that stuff off your teeth. However, like I've mentioned before, you cannot physically remove tartar or calculus from the tooth on your own with brushing and flossing. It is too hard. Okay? And so the gum starts to become inflamed, and it actually starts to do what? To pull away from the tooth. Now this probe is way past 3 millimeters. You are now having bone loss. The body is literally extracting the tooth on its own. Okay? Now, the inflammation indicating that you will indicates that you will have bleeding when you floss. Why is it there? There's something irritating the gum. So I just told you it's the plaque and the tartar. Okay, so let's take an even closer look at what is actually going on. Can you see this picture? This is my favorite picture of this whole entire presentation. I hope it's yours too. Okay, here you have a tooth. You have the gums, which is the pink area, and then you have the bone. Okay. You have the calcified bacteria known as plaque, known mainly as tartar, correction. And you have the plaque that's there that's covering it. The tartar actually becomes what is like a coral reef for fish. It's just a place where like, oh, there's plaque here, so let's just hang out here. So the bacteria becomes attracted to that and it sticks to it. Okay. With this tartar and the gums that's supposed to just lay smoothly up against the tooth, it irritates the gums. And what's happening is you have these ulcerations, these ulcers that now start to develop on the gums that's supposed to lay flat up against the tooth, the clean tooth. Can you see what is going on? There's an open wound. There's bleeding. If there's bleeding, that should tell you that there's a lot of blood there. The bacteria, if you look really closely at the picture, you have the bacteria now entering the bloodstream. Yikes. And then you have these little white blood cells that's going to the area fighting a battle they would never win. Okay? They're never going to win because they cannot get to the root cause, which is the tartar. And that's from negligence. That's from uncleanness. Okay? Now, once this starts to happen, and this oral bacteria, some of them are vicious. Okay, some of them are absolutely vicious because then more things starts to build up. Once they get into the bloodstream, can you see the connection with systemic diseases getting out of control? Now I tell you that I'm a dental hygienist and I'm also a nurse. Okay. Once the tissues are destroyed, this destruction reaches to the bone, and then once that happens, your body actually starts to extract the tooth because it's trying to save you from something horrific happening, which is systemic diseases getting out of control. Okay, there's now plaque, there's tartar, there's ulcers. There are PMNs, these little white blood cells, or known as polymorphonuclear leukocytes. These are your white blood cells that actually goes, and what they do, they engulf the bacteria, and when they kill the bacteria, they themselves die. And so now your body has to use the lysosomes in the cells to try and clean up all that mess, to get it out of your body. And so there's a constant war going on. Can you see the spiritual aspects of this? There's an invader. What we read in, I don't remember the book. Yes, The Great Controversy, where she talks about the origin of sin. She said, sin is an intruder. Here's your intruder right here. And this is a constant battle that is going on just to save the tooth, because the tooth was created there for a purpose, which is to keep the whole entire body healthy. Okay? If this continues to happen, okay, the destruction will continue to progress to severe periodontal disease. By the way, there's a poll that took place where 1,000 adults aged 35 and older, 60% of them knew little, if anything, about gum disease. That's more than 50% of the people don't know what gum disease is. Severe periodontal disease, which may result in tooth loss, is found in 15 to 20% of middle-aged adults. This is worldwide. Severe periodontal disease and untreated tooth decay in the primary teeth or in the permanent teeth is among the top 10 most prevalent disease condition known. Top 10. Okay, so let's take a look at this. What is periodontitis? This is an intense war as the body is trying to defend itself from this invasion. Unfortunately, it cannot do this without the help of someone outside of themselves. That person cannot take it off. You and I cannot get rid of sin out of our lives by ourselves. I'm trying to bring in the spiritual part, because any work that you have, no matter what it is, I am quite sure you can find a spiritual application for that job, so you can relate to another person that does the same thing, or to the person that you're doing the service for. This person cannot fix this in and of themselves. They must go to someone to help them, and they must continue to go to that person for help. You can't just fix it and clean it off and then think that that's it. Because once the destruction starts, which you can see in this picture, once the roots are cleaned off, you have a secondary attachment, and it must be maintained with the help of a professional. People will tell you that they will use oral rinse and herbs and all these things. Yes, you can do that. But if you cannot reach down into this pocket with a toothbrush, you're going to eventually need that help from somebody else. Okay, so this is where Christ comes in. We have to stay connected to him. Periodontitis is inflammation of the supporting structures of the teeth. War between your immune system and the bacteria takes place, and it is fierce. Bacteria enters as white blood cells increases in the area to take care of that war. Bacteria overwhelms the area. The body defends itself by breaking down the bone supporting the teeth. Your body's like, I can't fight this. We can't stop it. And so the body says, get rid of the tooth. If treated, the treatment is basically to stop the destruction and then to maintain. This is why some people who have dental insurance, who understand what's going on, they'll tell you that you need to come back 3-4 times a year for your teeth to be clean, because you can't reach down into that pocket. It's too deep. Untreated, this leads to natural extraction of the tooth, among other things, and it's painful. Okay. Here you have, you can see the destructions under the gums. The pocket will only get deeper and deeper, because guess what? The bacteria is just going to keep making its biofilm and the tartar and the calculus and build up, and it will keep going while your body's like, I have to get rid of this tooth. Okay? I have to get rid of this tooth. Here you have the destruction, and you can see it under the gums. Okay? Let me see something here. Okay, and then it starts here. Okay, it starts here. Let's move on. I just want you to keep this picture in mind because I'm going to touch on diabetes. Now, remember, there are a lot of other diseases that, and I can explain to you how it actually happens, but I'm just going to focus on one, and I'm going to focus on diabetes. Okay? I'm just going to focus on diabetes. 1 in 3. Now, when you look at it, approximately 98 million American adults above 18 that are 18 and older, this is more than 1 in 3 have pre-diabetes. That's in accordance to the CDC's and NIH. Okay, this is approximately 38% of adults 18 years or older. And guess what? Surprisingly, more than 8 in 10 of them do not even know that they have diabetes. Now, what does diabetes have to do with gum disease? And what does gum disease have to do with diabetes? Here you have a picture of where diabetes is most prevalent in the United States. Please take a good look at where it is most prevalent. Okay? And then you have to ask yourself, how come? Is it ignorance? Is it lack of dental care? What is it? And so we have a work to do. And most medical missionary training that I personally have been through, I have never seen dental presented as part of the training, yet it is so prevalent of a condition. Now, what does it have to do with diabetes? When it comes to diabetes and periodontal disease, I pretty much call it a tag team disease process. They like play with each other. Now, do you recall this particular picture? Remember, when a person eats their food that has sugar, the bacteria that has access to the bloodstream because of these ulcers on the teeth, okay, will feed on that sugar within the blood of a person who has poor glycemic control. This will then allow the bacteria to proliferate and multiply within the bloodstream. So the more a person consumes sugar, the more out of control both disease gets. They have periodontal disease and they have diabetes. One situation that is really bad is when a person has a gangrene infection. Now, this is uncontrolled blood sugar makes this situation harder to control. Now, as a nurse, I'm gonna lay my dental hygienist role a little bit off to the side and zero in on my role as a nurse. Now, I've worked on a post-surgical floor for a couple of years. And I recall taking care of a person who just had an amputation of her foot from her ankle down. This is called a metatarsal amputation. And I would recall, you go in as a nurse. I go in in the morning and I look at the medication that I have to draw because I have a certain time that I have to administer my medication to the patient. And I'm looking at the medication. I'm like, man, this person is taking some really heavy duty antibiotics. Now, for those of you who are familiar, this person is taking metronidazole, which is known as Flagyl. She's taking vancomycin. She's taking Zosyn or penicillin. These are strong antibiotics, okay? Strong antibiotics. And I thought to myself, man, this person's liver and kidneys are really being attacked here. After completing my assessment, I realized that while these medications are being administered to the patient, guess what? In my mind, I'm like, this will never totally treat the root problem because the cause was from her mouth. Now, when I became a nurse, my patients as a dental hygienist, they said, you should become a nurse because you're constantly talking about the body. Well, I became a nurse. This person had severe periodontal disease, okay? The teeth of this person's mouth actually looked like this, okay? Can you see the buildup, the tartar, the plaque, the recession, literally, and the spacing? Now, the spacing is a result of the body extracting the tooth and the tooth is becoming loose. And so the teeth actually starts to space because the bone is getting ready to fall, the teeth is getting ready to fall out. The radiograph Now, as a dental hygienist, as a dental assistant, we have to know how to look at the radiographs. We must, and as a hygienist, I must know what I'm looking at. And when you see this arrow of this tooth on the bottom, you can see the severe bone loss. This person may eventually be able to take that tooth out by themselves with their hand because of the amount of bone loss. Every single tooth has severe bone loss around them. That's severe periodontal disease. Remember, it is a two-way, okay? This disease, diabetes and periodontal disease, is a two-way, has a two-way relationship with this disease. Why? Because this person has uncontrolled blood sugar from the diabetic part, the systemic part. Well, guess what? When the gums are inflamed and ulcerated and there's open wounds on the gums that faces the tooth, the bacteria has access into the bloodstream and it's an open buffet because there's sugar floating all through the blood. And this person just had her foot amputated and the root cause was not addressed. You know what I did? I went to my boss, my manager, and I said, why is it that there's no dentists in the hospitals? And why is that not a part of their treatment plan? There was no answer. There was no answer. Okay, so the cause for the gangrenous condition of the foot was from her mouth and uncontrolled diabetes. It leads to other things. Of course, most people do not have proper dental insurance and most cannot pay for dental health. Okay, let's take a look at this. So here's a little picture of what happens. You have chronic periodontal disease. Okay. You have, it affects glycemic control, or is affected by glycemic control. And guess what? They just keep going at each other. The high blood sugar, the periodontal disease, the proliferation of the bacteria, which makes the diabetes even harder to control, and the blood sugar stays high, and it just keeps going on and on and on and on to the point where this person would either have to get their teeth extracted or they get their teeth cleaned in order to actually get that infection in the blood control. And then they would have to get their blood sugar under control at the same time. So why don't people know these things? Because they're not educated and they don't have access to the dental clinic. Why? Because financially, they can't afford it. Please understand that my role for this presentation is simply to educate, rather, to share information so that you can know what to look for, so that you can know what to talk about, so that when someone comes to you, you can ask them, tell me about your oral health. There's an issue with transportation. Some people can't even get to the dental clinic, especially the elderly and children. Children cannot take themselves to the dental facilities for them to get a proper assessment. You have privately owned dental facilities. Okay, going back to financial, there's 172 million Americans under the age of 65 have private health insurance, and only 45 million of them have any sort of dental insurance plan. Accessing oral health care is difficult for those living below the federal poverty level and for children covered by Medicare. This is in the United States. Okay, but this is actually true everywhere. Whether you're out on the island somewhere, some people don't have access. Most don't have access to dental care. Okay. Another barrier is transportation. Or elderly people and children can't take themselves there. Privately owned dental facilities, even with coverage, people frequently do not get needed services due to a lack of providers accepting or not accepting certain insurances. And then there is the public health facilities where there's limited care provided, however, because of socioeconomic status. Okay, but that is one place that people can actually go and get an assessment at no cost to themselves. And so what do? We educate them. Most people don't know because of ignorance, and ignorance is what leads to fear. And fear is crippling. It keeps you right where you are. And so educating actually empowers people to make conscious choices. Okay, but we must be willing to push forward and get the education that we know, that we need. Okay, so what are some ways that people can actually get these care? You can go to dental schools and dental hygiene schools. They're always looking for patients. We're always looking for patients. And most of the times you will actually get better and more thorough care under these conditions because you have a professor that's there and you have the student who has to care about what they're doing. And you would know if they're not. And then you can always say, I don't want this person to treat me. I want somebody else to. But you get a full exam, a full status of your oral health, and they will stay with you until you're finished. It's either at no cost or very little cost. I know I needed to take a patient with me to take my boards, my clinical boards for dental hygiene. And once upon a time when I took my boards, the exam was 8 hours long. I forgot where I lived when I was done with my written boards. Okay, but it's important to be able to talk to people about their dental health. So how do we approach this? Okay, you want to get a dental examination. First, if you do not know what your health status is, you need to get access and find out what it is. Don't go home and diagnose yourself based on what Camille just shared. Please just go and find out what your status is. You cannot see your bones by looking in the mirror. The dental x-rays is necessary. Nobody wants to be radiated. If you want to detox your body afterwards, go ahead and do that. But you should consider whether the benefits outweighs the risk. Just get it at least once a year. Just find out what's going on with your dental health. And it doesn't have to be once a year. It doesn't just once a year. It could be once every 2 years. But that's a decision that you would have to make. But you want to know what your dental status is. And I would encourage a dental examination. If you don't have access to a professional at this time, start by implementing proper oral hygiene. And I'm going to show that to you in a little bit. Implement the laws of health, okay? You have dentists in the United States, in certain states, one of the states that I'm licensed in, they do actually pro bono work. They have to in order to renew their license. You have things called the RAM clinic, RAM clinic, where they actually go and work in underserved communities where they actually take care of them. Your public health services and your dental schools, dental and dental hygiene schools, okay? And then put into practice everything that you learn. Just start cleaning your teeth. So let me show you how you prevent all of this. You want to start with brushing at least twice a day. Ideally, you want to brush your teeth after each meal. If you cannot brush your teeth after each meal, then rinse your mouth out with some water to get all that sugar off your teeth. Okay, you definitely want to floss, and I'm going to show you how to do that properly. And some other things to consider is now, when we say use an antiseptic mouth rinse, now I need to be very careful with this. Actually, I'm going to actually take this off. Give me 1 second. Let me just stop it now because I have learned okay, let's get back to this. I'm going to say use water for your mouth rinse, okay? The reason being is because there's something about this oral flora that actually helps with your body producing nitric oxide. I'm going to let you look up what that is, but that is vitally important, okay? If you don't want to use water, just use some water with some peppermint, like 1 or 2 drops of peppermint essential oil, good peppermint essential oil. If you want that minty, fresh flavor, breath, that's fine. Do not put peppermint in your mouth if you feel like your breath smells bad, because it's only going to make it smell more bad because you're adding sugar to your mouth and causing the bacteria to proliferate, which is going to cause bad breath. So don't put candy in your mouth to make your breath smell better. It actually does the opposite. Okay? Just rinse your mouth out with some water and try to brush your teeth as soon as you can. Other things that you want to consider is for patients who have dexterity issues, you can make that available by putting a tennis ball at the bottom of a toothbrush. You can have an electronic or sonic toothbrush. Those are really good. Same thing for flossing aids, and you really want to have good denture care. Do not wear your dentures all day, all night long. The gums need to breathe. They need to have air and relaxation. Okay, they need to be exposed to air. So how do you brush your teeth? Well, you want to angle your toothbrush towards the gums at a 45-degree angle to allow the bristle to get up into that sulcus. Okay, it looks pretty much like this. Okay, you want to get up into that sulcus. You're not going to touch your roots. If you do that, then you're brushing way too hard, and that's destructive. You don't want to do that. Okay. And so that's what it pretty much looks like. You want to brush the front of your teeth. You want to brush the insides on both sides, top and bottom, and right behind your front teeth. When you're done, your teeth should feel smooth. And at the same time, when you're done with brushing your teeth, you want to brush your cheeks and the inside of your lips and your tongue. Your tongue is where most of the bacteria like to hang out as well. And that's what causes bad breath. And bad breath is offensive. And so we want to make sure that we're cleaning our whole entire mouth. When it comes to flossing, okay, this is the cavity zone. Most people have cavities between their teeth because they don't floss. And so flossing is very important. Can you see where this floss is? It's right where the gingival margin is, okay? Now remember, there's a sulcus or a pocket that's around the tooth, like a mold, okay? Remove food and plaque from your teeth helps to fight cavities. You want to remove it from under your gums. And so this is what you're looking at. Your floss should pretty much, uh-oh, did I lose my picture? Hang on a second. Okay, can you see my screen? Yes or no?
Yes, we can.
Okay, so you want to take your floss and take it all the way up under your gums. That's a natural space between your gums and your tooth. Now, if that space is bleeding, it means that you have had plaque sitting on that tooth and it's causing the gums that's sitting up against your tooth to become ulcerated. Remember this picture? Okay, remember that picture? So you want to clean that space to prevent that from happening and keeping the plaque and from building up on the teeth and from becoming tartar. So that's the area you want to floss and keep clean. Now, at this point, I am done. Are there any questions? I have a bonus for you, but I want to see if there's any questions.
Okay, let me help with that. If you have a question, please raise your virtual hand and we will take you in the order of appearance. I see Samsung SM. Your hand was up first. You can go ahead.
Hi, good evening, everyone. Hello, Sister Camille's. I would just like to ask, sis, thank you so much for this lecture. I learned so much. And I saw a video, not an SDA person, so I'm just asking. He was saying, never take the toothbrush and brush your tongue. He was showing that you take, the tongue scraper and you use that instead because he said there was some explanation with the brushing of the, I don't know what you call the buds on the tongue, and that disrupting digestion and causing problems. So he was advising to use a tongue scraper instead. What do you say about that? I have another
Okay.
question.
Okay, let me do this one first. Yes, you have two structures on the surface of the tongue. They're called your filiforms and your fungiforms. Your fungiforms look like mushrooms and your filiforms look like velvet. Okay, they are taste buds. Okay, there are taste buds on the front part of your tongue. You have a different type of taste bud on the back part called your circumvallate, and that's where you actually have the taste of bitterness. That's on the back side of your tongue. Now, let me just ask this question. If you use a tongue scraper versus a toothbrush, are you not rubbing over the surface of those taste buds? You would be. So I don't understand why he would say that. Did he give an explanation for that? Because either way, you're cleaning your tongue. The main-
Well, he was saying that, okay, so when you're brushing your tongue, you know, you put the toothbrush and you either go up and down on your tongue. And he said that disrupting the order of those taste buds or the velvet stuff and the mushroom stuff, as you just named them, that would eventually just destroy the natural way it is, and it would hamper digestion. That's
Okay.
basically what he said.
For just by listening to it, I don't necessarily agree with that explanation from him. Nothing against you, because either way, you are actually rubbing something up against those taste buds. The main thing when you're brushing your tooth you're brushing your teeth, you want to use a soft bristle toothbrush, and even to make it softer, you run it under some hot water just to make sure that those bristles are super soft, because you do not want to become so aggressive. Because some people, they think they have to do something really, really, really hard for them to get something very clean. You're just brushing plaque off your teeth, and if it's soft, you're going to get it off with a soft with a toothbrush. That's best, and that's ideal. And then when you're brushing your tongue, you want to brush in a forward direction, because these filiforms, they actually lay back like velvet. So when you smooth out velvet, it's just smooth. And when you brush it in the opposite direction, they stand up, and you can see a difference in the shades of that velvet. It's the same thing on your tongue. So you only brush in a forward direction to get that clean. Now, that is not going to damage. I cannot see how that is going to damage your tongue, signaling to your stomach what is coming down. Their taste buds, you're still going to taste. You know, so if somebody has an issue with like glossitis, or they have geographic tongue where something systemically is causing those taste buds to be either eroded or the tongue to become swollen, then that I can see a problem with brushing, because then it's going to be very painful. But outside of that, we need to brush our tongue in a forward direction with a very soft bristle toothbrush, just to get that, because the bacteria lays under those filiforms, the velvet type. That would be my advice.
All right. And my second question quickly is this. I know of a couple who, when their children were under a year, the mom breastfed the children for well over 3 or 6 months. And then with the bottle feeds, when they started doing bottle feeds, they didn't use cow's milk. They used, I think it was a soya-based infant formula. But they did it in such a way, like when the children were asleep, they timed them just before they woke up, and they would make the bottle and feed the children while they were sleeping. So they would now, after drinking the bottle, sleep, not wake up at that time when they should, but sleep extensively. Now, one of the children, now grown up and now adult, has lupus. And I always wondered, is there any correlation between the way those children were bottle fed and one of the children developing this lupus disease? So I know you just said a lot of things happen from the mouth when children are, by the time they're 3 weeks old. Is it 3 weeks? That, we have to be so very, very cautious. So what are your views on that? And thank you. That's my last question.
Okay, I am going to have to get back with you, Vanessa, about that, because one thing I would do if I don't know the answer to something, I would go and look at what is lupus. We know that lupus is an autoimmune disease, and I would have to go and look up what is the cause of lupus. I cannot see how I cannot say if that was a cause or not because I have not studied the cause of lupus, although I know that it is a an autoimmune disease. So I would have to look that up. Now you gave me an assignment to do. I don't mind.
Okay.
I don't mind it.
Okay, but is it a good practice, sis, that, I know, like with Jessie, she used to get up like every 2.5, 3 hours for her breast milk or bottle milk. All right. So when a baby sleep, after they sleep, they get up at that natural time and you change them and then you feed them, you burp them, they are awake, and then you put them back to sleep. But here it is, the children and just before they wake up, you give them the bottle. So they'll be drinking that milk and then they'll be sucking the bottle in their sleep. Perhaps it's a reflex, I don't know. I just marveled at it. And change the diaper and they just continue sleeping. Can that cause any trouble there in the mouth? Thank you.
Yes. The sugar in that milk is not good. The child sleeping while they're drinking, that's dangerous. Because if that child starts to choke, that's not good. And one of the things that we're told is some people, they tend to get very sleepy after eating a meal. And that's because the blood is being pulled from the brain to the stomach so that the digestion can take place. That is not a safe practice. And one of the first fights that I talked about as far as children is you never put them with a bottle in their mouth. That's dangerous from so many different angles.
Okay. Thanks so much, sis.
You're welcome.
Thank you, Sister Vanessa. Okay, we're going on to Marlene with your question.
No, you're
Go ahead.
Thank you for the great information. And I always think about the mouthwash. That's one of my big things. And now I have to rethink. I don't use toothpaste. I use either baking soda or tooth powder, but I do use the mouthwash. So now I have to rethink about the mouthwash. So thank you for that information. I'll definitely use peppermint with the water. I noticed you didn't talk about it, but on my teeth, like when I'm brushing my teeth, I tend to look at what I'm doing. I'm not sure why I do that, and I'm thinking a lot of us do it. And I noticed that in my teeth, some of them have like a line going through. I don't know what it is. But when I go to the dentist, and dentist never say anything. So is that something I should be concerned about and bring it up to my dentist?
I personally would like to see what that line looks like. I don't know what it is. You could have like a what's called a fracture line, which is not really a fracture. It could be something that happened in utero. I would have to see what it is. And so for me, wanting to see what it is, yes, I would encourage you to ask your doctor, what is this line? Just ask them what it is so that you can know for yourself.
Yeah, it's not one line, it's many lines in the teeth.
Okay.
So I'll definitely ask them. Thank you.
Yes, definitely ask so that you can have a peace of mind.
I will. And thanks for that great information. I appreciate it very much.
The other thing with baking soda, you don't want to use baking soda to brush your teeth. It's too abrasive. You're gonna encourage your teeth. Remember, those dental tubules, they are there, and the crown of the teeth actually, the crown of your teeth actually protects those tubules. And so when you're brushing away with when you're brushing the enamel away, it's like you're sandblasting your teeth. Those dental tubules are going to communicate with the outside of your teeth, and your teeth are going to become sensitive over time.
Oh my gosh.
So when you look at this picture, you see where it says enamel on the upper right. When you're brushing with baking soda, you're actually brushing that enamel away, and you're getting closer and closer to those fluid-filled tubules, and you will feel that sensitivity.
Oh my God. Thank you. So any suggestion on what to use? Should I
Sister
just
Rhonda, you
continue
want to
using the
take
tooth
that one?
powder? Well, it's okay. I don't want to put you on the spot, and that's not good.
No,
what
you're
I
fine.
do.
You're not putting me on the spot. One of the things is because I am a licensed healthcare provider, I cannot suggest what you use or tell you what to use because then I open myself up to being liable if you do use it and then say, well, Camille said I can use this. That put my license at risk.
Right. I understand that.
You don't, okay, just so that you know, just for everybody's sake, you don't need toothpaste to brush your teeth because the whole purpose is to get the plaque off your teeth. Toothpaste doesn't necessarily do that. Even if you just take peppermint water and brush your teeth with it, that's perfectly fine. Just make sure you brush your teeth.
Okay. All right. Thank you. I appreciate it very, very much. Thank you.
You're welcome.
Thank you, Marlene, for your question. We go now to In Need of Grace. Unmute yourself.
Good afternoon, everyone. Thank you so much for this presentation. I feel like, it's a little too late for me in a lot of ways. Growing up, I had really lovely teeth, and I used to take care of my teeth because I did pride myself in my smile. Oh, the Bible says pride goes before fall. I think that's why I end up in the predicament where I am now. But I remember one time I went to the dentist. I saw a little cavity in my tooth, and I immediately went to the dentist upon seeing it. But when I went there, the dentist kept drilling, and I thought, well, this little thing, why is he drilling so much? But then he told me that my teeth starts to rot from the inside out. So by the time I notice the cavity, it's already, advanced inside. He told me that I inherited chalk teeth. I know that my mom had a lot of issues with her teeth, but is that possible to inherit such a teeth? And what can I do? There was another question that I want to ask, but maybe you should answer this one first, please.
And let me ask you, how do you know you had a cavity in your teeth?
Because I saw it. I have those little mirror that you have, those white thing, and you put in your mouth. I saw the brown spot, or black spot, if you want to say it. Yeah.
Okay. All right. So to explain what the doctor was saying is these tubules, if you look at the picture, you have one little spot and then it just spreads. It's like a network. Okay, it's like a network, and so it spreads a lot more on the inside than it would on the outside. Now, when you say your mom had bad teeth and do you have bad teeth, I'm just going to tell you this. It's not a matter of whether your mom had bad teeth. You have the genetics, is what you do that actually contributes to what happens to you. So you may have a predisposition, but it's how you handle it and not knowing how to properly take care of your teeth could be a major contributing factor for you. But the thing is since you're paying so much attention to your teeth now, is there something wrong with your teeth now?
Well, I don't think I lost several of my teeth now.
Mm-hmm.
And well, it's frustrating because sometimes you hear, don't brush with this, don't brush with that. You start doing this and then they come and tell you, don't do that. So I was brushing with a normal toothpaste, and then I heard this is not good. So I started brushing with baking soda, and then I heard that is not good. So it's kind of frustrating, to be honest.
Okay, I can understand that. Now keep in mind that, and this is why I feel the need to do this, because when you're looking at this plaque on the screen, really the main thing is just mechanically removing it. You don't need a toothpaste to do that. Okay, we're conditioned to think a certain way. And then people who are making money, they would say brush with charcoal, brush with baking soda, brush with Aquafresh. I'm not knocking any of those things. But the thing is, you want to really think about what's going on. And most people aren't taught it from such a simple fundamental level, like I'm doing it here, to understand I don't really need to use all of these things. And as a matter of fact, that's a conditioning. Remember that quote that I used from Temperance? If you can only see what's inside my head. And what I would love to share with you is this is a conditioning, and it is to keep people in subjection to what they are being taught. Just get the plaque off your teeth with a simple toothbrush. With children, if they're babies, use a rag. Just a wet rag, a warm, wet, clean rag, and get their teeth brushed. And don't use the same spot over and over again. You know, like when people are flossing, they use the same piece of flossing pick thing, and they'll move the bacteria from one place to the next. Your objective is to get the bacteria off your teeth, even if you don't use toothpaste. Some people use a chewing stick. Some people don't have toothbrush. They use a chewing stick, and that's perfectly fine.
Okay. So there is such a thing as chalk teeth.
As what?
Chalk teeth. CHALK. Chalk. That's
Yes.
okay. Okay.
Now that's something altogether different from what we're talking about, but yes.
Okay. A second question. My son, the two front teeth, I think that's the incisors.
Mm-hmm.
One of it is straight. This same teeth that you're showing there. One of
Mm-hmm.
it, the other is sort of leaning towards the other one, and like it's not shaping up right. What can I do for him at this stage? He's 5 years old.
Oh, don't worry about it.
Okay.
Don't worry, because I'm going to tell you this, because his other teeth are coming in, and God has made our bodies so well. I had the same, even as a dental hygienist, before I had my child, I had the same concern about my child's son. I only have one child, so it's my first time, and I'm like, his teeth are coming in crooked, you know? And the doctor's like, don't worry about it. His other teeth are going to come in, and it's going to straighten everything up. At that point, then when his teeth all come in, then you can consider orthodontic care, which is braces or whatever. But allow his teeth all to come in before you make a decision, because if you start shifting stuff now, you may very well be shifting stuff that is up under the gums, getting ready to come in. They will fall into line. If they don't, then you would know what to do. So the child is pretty young.
Okay. Thank you very much.
You're welcome.
Thank you very much for your questions. I see some questions in the chat. How about hydrogen peroxide and baking soda in water to remove plaque from teeth? So you said that baking soda is too abrasive. What about the hydrogen peroxide?
Okay, the hydrogen peroxide I would not use all the time. When I use hydrogen peroxide, let me see. Let me see if I can show you something here. When I use hydrogen peroxide is when I'm doing like massive cleaning here. Hang on. All right, can you see my screen?
Yes.
Okay, here I have like a million kids that came in and adults who walked through. I went on a mission trip, a dental mission trip out in Ebi, in the middle of the Pacific out there, where they dumped off nuclear bombs in the water out there. So these were children that were there, and their teeth were absolutely caked on with plaque. And to actually get to their teeth, I actually brushed their teeth with hydrogen peroxide. That's the only time I would use it. At home on a daily basis, I would not suggest that you do that. Okay, I wouldn't suggest that you do that at all, because you don't want that on the oral cavity. Another time that I use or hydrogen peroxide is after post-surgical, when I worked with the periodontist, and we would do oral surgery. And what happened is when they come back for a post-operative care, I will actually clean the site with that. You don't, listen, the oral flora in our mouth is so vitally important. You want to keep it in a state of health and not kill off all those good bacteria. Because what you're going to do is really, really damage the production of nitric acid. And you have to learn what nitric acid is. Okay, it has a lot to do with people who have hypertension, a lot to do with people with heart disease, and that oral flora plays a major role in the production of that particular substance gas in our bodies. So don't go extreme trying to get your teeth cleaned and be so zeroed in and I got to remove all this bacteria. The bacteria belongs there. You just want to keep the plaque from building up. Okay, so you don't need hydrogen peroxide to brush your teeth. Only cases I use it on is when there's gross plaque buildup and I need to get this out off their teeth so I can make sure that I'm working in a clean environment. Because if I nick their gums with my instrument, I'm going to allow that bacteria to have access to their bloodstream. And I don't want to do that. So I try to get that cleaned up as much as I can and then allow their body to rebuild the oral flora. So you don't need hydrogen peroxide to brush your teeth or clean your mouth or to even rinse with.
Right, that's good to know. Also, you spoke about using warm water to soften the bristles of the toothbrush so that it will be soft enough to brush. And here is a question: how to properly sanitize your toothbrush after use? Is it the same using warm water? Tell us about that.
You can dip it in some hydrogen peroxide.
Mm.
That's what you can do. Just dip it in some hydrogen peroxide. Don't leave it in it, but you can, and you will see the fizz. You actually see the fizz, and that's telling you that the hydrogen peroxide is killing those bacteria. And until the fizz stops, you can take it out and then let it air dry. Don't leave it in a moist, like locked up type of thing. Don't do that. Bacteria like moist area.
Yes.
Okay.
Okay. And then another question in the chat.
Oh,
What?
one more thing. With that toothbrush, okay, you want to change it at least every 3 months. Some toothbrushes are made with indicators on them. Change it at that time. And you definitely want to change your toothbrush after you have been sick. Just get rid of it. So if you're sick, just get rid of the toothbrush, get a whole new toothbrush because you're going to reinfect yourself.
All right, that is excellent. Next question in the chat: what natural solution is best to brush with? Charcoal, chew sticks, shredded, or neem stick? And you spoke about the chew sticks. Good. What about charcoal or neem stick? And let me add here, what about oil pulling, like in using olive oil or coconut oil to do that oil pulling technique?
So I have done oil pulling. I believe it does work. I would prefer to use coconut for oil pulling. And that's all I'm going to say about it. It's your choice.
Okay.
But it's actually a good thing.
Right. And what about charcoal and neem stick?
Okay, I've never seen a neem stick before. The chewing sticks I have, charcoal, I would not brush my teeth with charcoal. Again, it is abrasive. Okay, they have these charcoal toothbrush and brushing. You don't think about what you're actually doing. If it is abrasive, okay, think about what the purpose of charcoal is. The purpose of charcoal is to absorb poisons in the body. It's to pull poison to itself. This is why we use charcoal. If you get a food poisoning or if you get a snake bite or something, you want something that's going to pull the poison to themselves so you can expel it out of the body. Brushing with charcoal, I don't see the purpose for it. Okay, except that it's going to damage the enamel over time.
Interesting. Thanks for that. Another question before we go to the hand that is up. Do we really produce enough bacteria in the mouth to produce all our vitamin B12 daily?
That's a good question. And I'm going to tell you, vitamin B12 is produced in the stomach. And so they tell you in the morning when you get up, don't brush your teeth. You need to swallow that. Now, if your mouth is dirty and you're not brushing your teeth properly, you're going to be swallowing more than just vitamin B12. But the vitamin B12 is actually produced in the stomach and it comes up into the mouth during the night while you're sleeping. So in the morning, you just drink your lemon water, okay, and then get that back into your body. It's very important for our bodies. And so that's what it is. But you need to have good oral hygiene before you go to bed. It's not your mouth that produces it. It's your stomach that does, and it comes up into the mouth.
Great. Another question, how about charcoal toothpaste? But you spoke about toothpaste, you spoke about charcoal. The person is saying it is smooth. Is this really so?
Well, I've never used charcoal toothpaste. If it's smooth and you feel it's safe, then that is your choice. It's okay. But just be mindful if your teeth, and I'm not telling you that, oh, your teeth is going to get sensitive, but if you start feeling some kind of sensitivity, you need to pull back from it. You need to pull back from it. But just keep in mind what the purpose of charcoal is. And keep in mind that a lot of these things are marketing, coming from a marketing angle. Everybody knows that charcoal is good for you, but you have to know why the charcoal is good, how the charcoal works. Okay. And if you're trying to pull toxins, what toxins are you pulling out of your mouth with charcoal? Because that's how charcoal works. And so what people do, they actually capitalize on people because people don't know how the charcoal is actually used. So it's a marketing, it's a money-making thing. And I would dare to say that because what's the whole purpose of charcoal? So just be mindful of it. If you feel comfortable using the charcoal, I cannot tell you not to use it. And I'm not arguing against it either. I'm just trying to help people to understand, know why these things are there, and are they really pulling your leg and money out of your pocket unnecessarily?
Okay. Someone would like to get in touch with you via WhatsApp for a consultation. Do you do consultations, and are you willing to share your contacts to arrange same?
Do you want me to send you my phone number? Let me put it in there.
Are you okay with it being placed in the chat for everyone to see, or you prefer private?
There, I just put it in.
Oh, great. Excellent. Thank you so much. So there is Sister Camille's number. Feel free to contact her should you need a consultation or to have some other questions answered. And our last question for this evening, can you remineralize your teeth with sea salt? If so, how can you use it? What is the dose and frequency?
I was not expecting that question, Camille, but I'm happy that somebody did. And before I do that, because that's going to be in a part of my bonus slide, okay? But I want to address this one thing. Baking soda is sandpaper. It's like sandblasting, yes. And when you digest some of that baking powder, it disrupts the pH in your stomach, and this will disrupt digestion. Now, let me just comment on this. We are told in customs and diets and food that we should not ever use the baking soda. It is no good. Now, I don't know about disrupting the pH in the stomach. It will if you do, because baking soda has it's like a 9 or above or something like that pH. But most importantly is you have to understand the function of your kidneys. Your kidneys produces sodium bicarbonate, which is baking soda. And when you're taking it in too much, you can damage your kidneys. This is why we're told not to cook with baking soda, because even if it's aluminum free, it's still baking soda, and you're going to really have some kind of adverse effect on your kidneys when you use that. It is not necessary. It is not food, and we should not be putting it in our bodies. Yes, we use it for like soaking stuff in some medical missionary application and remedies, but you want to be very careful with baking soda. Okay. Now, can you remineralize your teeth with sea salt? You can remineralize your teeth. I don't know about sea salt, and this is where I'm going to show you something. Okay, let me go back to this. Now, I'm going to show you this, and this is a personal thing. Okay, and then I'm going to end this. Was that the last question, Camille?
Yes, it was.
Okay, can you see this picture?
Yes.
Now, this is a white spot. Can you see the white spot on that tooth?
Yes. Yes.
Okay, now I can't get it any bigger than this, but you can actually see like these little white lines on the tooth around that white spot, yes?
Yes.
Okay. Now, this person used a product They heard about this product and decided they were going to use it. Now, this white spot it's called enamelplasia, where the enamel did not develop completely. Okay, and then on top of that, the story is this person was drinking out of a glass bottle, and she's playing around, and one of her siblings kind of hit the bottle. It was a Tropicana bottle, and it hit her tooth, and it cracked her tooth. And for years, well, somehow the crack did not break off in this weak part of the tooth, and that was amazing in and of itself. Years go by, like 20 years go by, and the tooth is still intact, because this person actually kept their teeth very clean, keep the oral environment at the right pH and everything like that. Okay. Then the person started using something. Can you see this picture here?
Yes.
Do you see that white spot on the tooth?
No.
No. Let me tell you how awesome God is. I'm going to make it even bigger. Can you see the white spot there?
No.
There's no white spot. You see, the enamel, while it is a form of bone, is actually set up like crystals. And if you've ever grown crystals in a 5th grade or 6th grade classroom lab, you have to have the proper environment for the mouth for that to happen. And keeping the teeth clean. We're talking about remineralizing. That tooth was not fully mineralized, okay? Let me show you that picture again. It was not fully mineralized, and this is why you had that white spot. But somehow, using a particular product, okay, it actually filled in the crystals of that white spot. Within the space of 3 weeks, after years of having this person was what, like 16 when the cracks came up, but they always had that white spot. At about 40 something, 3 weeks of using it, and the crystals actually laid down properly and complete the development of that tooth. Yes, you can remineralize your teeth. Okay, yes, you can. Now, I'm going to tell you who this person, that's me. And this is why I'm going to talk about it freely. And I'm going to tell you exactly what I used. And I'm going to tell you, you need to be careful with this thing. It was the Uncle Harry's that I used. This is my testimony. And if I'd never seen it, I wouldn't even mention this product to you. Now you're going to use that on your own. I'm just showing you what it did for my teeth. Okay. Now you have to be careful with this particular item, because if you use too much, what I've experienced is that it put ulcers on the roof of the mouth. Because I was like eager to get my teeth. I mean, there was nothing wrong with my teeth. I just wanted to use something natural, right? Now, I didn't even realize that white spot went away until like 3 weeks later. I'm like, wait a minute, there's something wrong with my teeth. I don't see this white spot anymore. So there it is. And I have the pictures to show it, because this is my mouth. This is what has happened to me. And so when somebody has like a white spot, like what they call an incipient decay, where there's a white spot, yes, you can remineralize it. Don't let it get out of control. Whatever it's chalk teeth, or because you could actually say that the enamelplasia is hypoplasia is chalk teeth. Try it and see what happens. Now, if you have any kind of allergic reaction, I am not responsible for it. This is what I did. I need to make that emphasis, okay? I want you to make sure that you look at the ingredients and you decide whether you want to try that or not. But I am showing you what happened to my own teeth in the space of 3 weeks, and I did not realize what was going on. That was when I went and really looked at what remineralization was, even as a dental hygienist who's been in dentistry for over 20 years. And I've never seen this before. And I thought to myself, oh my goodness, you can. Now, if you have like growth decay, I don't see how that's going to work. It's going to take you years for that to build up. But there's more research that's needed. I don't want to sound like a typical journal, but you need more research for that. I can see why they say those things. Okay, so that's my bonus, and I'm hoping I answered your question.
Oh, yes. Thank you for that bonus. A personal testimony always puts the icing on the cake. And, you know, I just want to say thank you so very much, Sister Camille. My name's Aiken. I'm even more happier now that we share the same name after hearing this presentation this evening. It was simply amazing to move from how the enemy attacks in terms of his strategy to kill, steal, and destroy, and how we made that spiritual link in terms of plaque and needing an external factor, even Jesus Christ, to take away our sins. And what interested me as well is the correlation between oral health and diabetes. That is something I never heard before. And definitely as a medical missionary, is something that I will look deeper into because I do counsel persons with diabetes and so. So this evening was really phenomenal. Thank you so very much. And even answering all the questions, which help us to put things in perspective and to know that we do not have to use toothpaste to clean our teeth. I think that is just amazing. So thank you so much. And we are happy that you answer the call to share with us this evening. And I can already see that we need a part 2. And I hope that when we do call on you again, you will be available. Thank you. So with that, we want to close for this evening. Oh, one other thing, you mentioned that, you know, dental health is not something you have seen in most programs, and it's definitely something we have to look at and include because it is so important. It could lead to systemic illnesses that this factor has been overlooked. So thank you for helping us to understand this. And I see a hand go up. I'll take this hand just before we have a closing prayer. Chef Joanne, you can go ahead.
Good afternoon or good evening, Sister Camille and everyone else. Sister Camille, my question for you, as you show on the screen right now, the microbiome of the mouth itself. How does this affect the gut microbiome? This dental disease and systemic condition.
Sister Joanne, Chef Joanne, I'm gonna tell you that Camille James just said it. She's gonna have to have a part 2.
Bless the Lord.
Because you are putting me in a situation where we're gonna stay here longer. And if you look at the actual screen right now, every single one of these diseases has their connection with oral disease.
Sister Camille, we knew this was going to happen, Sister Camille. Yes, everybody, we are going to try our best to book Sister Camille Aiken to come back for a part 2. So we are so grateful for her and for her time, but we really have to go.
Yes.
All right, thank you so much. So let us pray. Heavenly Father, thank you so much that you love us. You are our creator. You made us fearfully and wonderfully. And thank you for availing your daughter, Sister Camille Aiken, with your Holy Spirit to bring this rich information to us. Things that we have not thought about before, things that we now need to consider and implement. And Father, may we indeed allow this message to bear fruit in our lives, even as you desire that we prosper and be in health, even as our soul prospers. I pray for every participant this evening, and I pray, oh God, that you will continue to strengthen us to do your will, so that we can glorify you in our bodies, in our mouths, as we speak of you, as we sing of your praises, as we smile and give our face a rest and give hope to others as well. So thank you for all that you have done and all that you are doing for us. And dear Father, may we remain faithful so that we can hail you as King of Kings and Lord of Lords when you come. These and all of the mercies we humbly ask in Jesus' name. Amen and amen. So thanks again,
Amen.
everyone. Have a wonderful evening. See you tomorrow morning on our worship session.